The following program on PBS 39 is made possible in part by
Beautiful baby, you're sweeter than strawberry pie. Just like the morning, your smile brings the sunshine.
The Parkview Family Birthing Centers, with everything you need for baby, plus birth planners, expert physicians, midwives, and more for you.
I'm a Parkview mom. You can be too.
Learn more at parkviewmom.com.
Hello, and thank you for watching Healthline here on PBS 39. I'm your host, Mark Evans. It is March, and it is Colorectal Cancer Awareness Month, and we'll be speaking about colorectal diseases tonight, along with Dr. Sunil Reddy, and we've had you on the program about a year ago or so.
That's right.
I understand, and I remember that we had a lot of phone calls from our viewers asking very good questions. And just to let our viewers know, we're going to have a very candid conversation about colorectal diseases and cancer and so forth, so please expect that as you're watching the program tonight. Well, Dr. Reddy, we really appreciate you being here tonight. We know you're a very busy physician, but taking the time for this, okay?
Thank you.
And we're going to go ahead and open up the telephones, 866-969-2720. That's the long distance number, rather. And then the local number is 969-2720. Please call at any time in the next half hour. It is public television. We won't be stopping down for commercials, so we'll be watching for your phone calls. Well, let's go ahead and get started, Dr. Reddy, with the statistics about as far as how many people in the United States are actually facing colorectal diseases.
Well, I would say at least 60% of the people in America have some colorectal problem, be it constipation or hemorrhoids or cancer or diverticulitis. There are a lot of colorectal issues out there.
About 60%?
Yes.
Okay, and are we getting closer to coming up with some cures for some of the colorectal cancers that you're encountering?
Certainly, yeah. The colorectal cancer world has made remarkable progress. If you detect colorectal cancer early enough, it's curable. That means 100% cure. And people live almost 3 decades after colon cancer being cured. So it's one of those few cancers where early detection and treatment offers good lifestyle and permanent cure.
And early detection is the key.
Yes.
Okay, well, we'll talk more about that a little later in the program. But you know, in order to find out if you have problems with your colon or the rectum area, you got to have a colonoscopy.
That's right.
Please explain the importance of that and how often we should have one.
Yes. Colonoscopy is the best screening method that's available to detect colon cancer. When I say screening, colon cancers most of the times begin as polyps. Polyps are like little bumps in the colon that grow and become cancers, and the colonoscopy is a valuable opportunity to detect those polyps and remove them. It's a procedure, it's half an hour procedure. The main problem with colonoscopy is people need to get their colon completely cleaned out, and this kind of makes people shy away from the procedure because there are concerns that the bowel prep is tedious, it's troublesome, but there are new bowel preps now which are much better than what used to be there in the past, and before the patients know it, it's over. And it is such a valuable opportunity to detect and treat colon cancers.
And I've had a colonoscopy. In fact, I'm due for another one fairly soon, and believe me, it's really nothing to it, especially when you have a good physician. So keep that in mind. And so when and how often, and what particular age, let's start with this question first, what particular age do you need to start worrying about that? And then after that, subsequent colonoscopies, how often?
Good question. So for the average patient, when I say average, it means patients who have no one in the family with colon cancer. For such people, they need to start colon screening when they hit 50 years of age. So that's very important. For people in whose families there is colon cancer, the screening age is at least 10 years before the age at which colon cancer was found in the family. And from then on, it depends on what we find on the colonoscopy. If it's a normal colonoscopy, then its colonoscopy is needed every 10 years. If they have polyps, then it's usually at least every 5 years, and more polyps more frequently.
And your physician would certainly recommend the number of colonoscopies you need to have, or at least how often, I should
That's
say.
right.
Okay, well, very good. Let's talk about the complications of the colon. And when we talk about the complications of the colon, what do those involve?
The colon is 5 feet long, but today I'm going to focus on, excuse me, today I'm going to focus on the complications of the bottommost portion of the colon, which means the anal canal. I want to focus on this because I see a lot of patients who have these issues going on, who are unaware that these can be treated, and sometimes colon cancer can present as anal issues. So today we will discuss about those.
Okay, and sometimes the symptoms may not be what you think they are.
That's right.
And
Yes.
expound on that a little bit.
It's customary for physicians as well as patients to say everything down there on the bottom is a hemorrhoid. And hemorrhoids can have so many ways of presentations. People can have bleeding, people can have pain, mucus leakage, incontinence, and all these things could be different issues.
So you might think you have a hemorrhoid, but you have something maybe a little more serious.
That's right.
Or really serious.
Yes.
All right. Let's go ahead and answer this question. Hemorrhoids, and we have a call coming in. We'll get to Helen in just a second, but what is a hemorrhoid?
It is actually a part of a normal anatomy, which means all of us have hemorrhoids.
Oh, we do?
Yes, we are born with hemorrhoids.
Oh.
And they're essential for a healthy colon and rectum. With time and for various reasons, hemorrhoids can get larger, and that's when they cause trouble, like bleeding, prolapse, pain, and so forth.
Okay. All right, well, let's go ahead and we'll stop right there and pick up after we talk to Helen on line 2. Helen, thanks so much for calling Healthline. Your question for Dr. Reddy, please.
Yes, I have this question. I have chronic constipation, and other than Miralax and milk of magnesia, I would like to know what I can do to eliminate that, and I am 88 years old.
And you
I
don't?
have always had constipation.
Okay.
Well, Helen, you're not alone in this world. Constipation is a very common problem. You have tried Miralax and milk of magnesia. There are other options too. We need to have a complete approach to treat constipation issue. First, focus on increasing the water intake. Try to take some fiber supplements in addition to the Miralax and the milk of magnesia. Regulate your bowel patterns with adequate amount of physical activity. Increase the amount of fiber in the diet, and these are actually the first steps in managing constipation. Once these things do not help, then we do an evaluation, which first will be a colonoscopy to make sure it's not something other issues causing the constipation, and then we have other treatment options available as well.
All right. Thank you for your call, Helen. We appreciate that. As we're getting more phone calls in, let's go ahead and continue with symptoms that may not be what you think they are. But you talked about hemorrhoids a few minutes ago. Anal fissures?
That's right.
Okay. And anal fistulas.
Yes.
Similar symptoms, but distinctly different issues. You want to break that down for us?
That's correct. Now, let me talk about anal fissure because this is so common. When people have hemorrhoids, the most common problem is bleeding. But when people have fissures, they will have severe amount of rectal pain. So severe that they describe as passing razor blades, and so severe that people stop eating because they don't want to go and have a bowel movement.
Oh.
Yes. And sometimes they also have bleeding. It's basically a cut in the anal canal. Just a simple cut, but since it is in a sensitive area, people experience too much pain. It's very easy to treat. The first thing to do is to attack constipation. Make sure they have regular, soft bowel movements. And with that, the anal canal gets a chance to heal, the cut goes away, and then it's gone.
So most of those can heal by themselves.
Yes.
Okay, that's good news. Now, anal fistulas.
Yes. Anal fistula is a connection from the anal canal to the outside skin. And people usually present with passing some amount of pus on the outside. Most fistulas begin as abscesses, as pus pockets close to the anal canal. These abscesses burst out, and then the connection gets established, and that's when we call it a fistula.
Okay.
Unfortunately, most fistulas need surgical therapy. It's important to look at these problems because sometimes anal cancers and rectal cancers can present with similar problems like pain, bleeding, mucus leakage. So it's so important to get these checked and get them treated and make sure it's not cancer.
Well, and we were talking about hemorrhoids, anal fissures, and anal fistulas. Are any of those, can those turn into cancer? I mean, is it common for those to turn into a cancer?
Not typically. Sometimes patients who have had infections in that area for decades, they are at risk of having anal cancer, but not usually. These things are distinctly different. But cancers can present like a hemorrhoid or a fissure or a fistula. So that's where it becomes important to get checked and then have a colonoscopy and make sure it's not the bad things.
Right. And you know, we're talking about to some, a very delicate subject, and we're being very candid about it. But put our viewers at ease. I mean, you are a medical professional. You deal with these things all the time. When somebody needs help, they should not shy away from getting the help. I mean, you're an expert on this,
Yes.
on these things, and you've seen several cases before.
Yes.
So it's what you do.
Yes.
And so they shouldn't really be afraid to come to
No,
a
not at
physician
all.
like you.
Not at all.
Right.
I think the main concern what patients have is, first of all, they're shy to talk about these issues. Second, they think they're the only one probably having this issue, which is not true. A lot of people have those problems. The third is they're worried about pain. They think it's a painful examination. We in the office do not want to hurt these patients. We want to make sure we know what's going on and get the treatment that they need.
And I think another thing too is that you're going to be inspecting or observing areas that many people don't see.
That's right.
For the most part. So I can understand why they'd be shy, but they should not be. It could be a lifesaver. All right, well, we have another call coming in, and Jerry wants to remain off the air, but he's asking, when a person has a colonoscopy, doctor, and a polyp is found, how long has that polyp been growing?
Jerry, that's a very good question. So the polyp, when we see polyps at the time of colonoscopy, usually they are small, say 5 millimeters to a centimeter. A polyp grows very slowly most of the times. Typically, by the time we see a polyp of the size of, say, 1 centimeter, it has been there for at least 3 or 4 years.
1 centimeter, how big is that? What would you?
Like a quarter inch.
Quarter inch.
Quarter to half an inch.
Okay, all right. All right, well, very good question, Jerry. We appreciate that. The telephone number is 969-2720, or long distance, 1-866-969-2720. We're talking to Dr. Sunil Reddy, who is a colorectal surgeon, and he's been on the program once before, and we appreciate his time tonight. All right, well, let's go ahead and move on to some other issues, and let's talk about some of the other issues besides the ones we've mentioned that you see in your office from time to time.
Well, the other problems are people can have inflammatory bowel disease, like Crohn's disease and ulcerative colitis. It's a completely different problem. Again, they present with the similar issues: diarrhea, rectal bleeding, abdominal pain. These are actually inflammatory bowel disease, which means they have an autoimmune reaction causing inflammation of their bowels. Depending on what disease it is, a segment of bowel could be involved or the entire bowel could be involved. Again, these patients are at higher risk for colon cancer than the average population.
Okay, so if you have those types of issues, you must get those addressed.
Yes.
All right. Well, let's talk about the causes and treatments of some of these things, and you can go ahead and start wherever you'd like. So where would be a good place to start after we've had this discussion so far?
Well, let's talk about the most common issue, hemorrhoids.
Okay, what causes those?
So as I said earlier, we all have hemorrhoids to begin with, and when they get larger, and that's when they cause trouble. And things that can make hemorrhoids larger, most common reason is constipation.
Okay.
If people do not have regular bowel movements, if they're straining too much for a long time, these hemorrhoids, which are usually small, get larger, they start prolapsing out, and then they get rubbed against hard bowel movements, and then they start bleeding. So that's the crux of the problem. When we attempt at treating the hemorrhoids, the first thing we do is at least 6 to 8 weeks of non-medical management with lots of water intake, fiber supplements, stool softeners, laxatives, making sure their bowel habits become regular. Majority of the times, just this is enough to take care of hemorrhoids, and the bleeding goes away.
Well, before the show started, we talked about how candid we were going to be speaking tonight, and we were talking about how long people actually sit on a toilet, and that could be affecting hemorrhoids as well.
Yes.
And why is that?
When people sit on the toilet to have a bowel movement, it's the gravity of the gravity and the position of the patient. It makes the blood column put the pressure on the hemorrhoids, which are on the bottom side, and that makes the hemorrhoid to get larger. Typically, people sit for 3 to 4 minutes when they have a bowel movement, but of late, the trend is people browse on their mobile phones, they watch Netflix, they watch movies, they read books, and the longer they sit on the toilet seat, the longer they're straining, and that just makes everything bad as far as hemorrhoids are concerned.
So really, the object of the game when it is time to use the stool is to get on there and get off of there as soon as you can.
That's correct.
And is it because of distractions, or people just need more personal time, and that's a as some people call it, the throne in the bathroom. It's a place to sit down. That's probably part of the problem too.
It is, yeah.
Okay, very good. All right, well, let's go to line 5. In fact, Mary is calling in and would prefer not to be on the air, but Mary says she's 70 years old. She has chronic diarrhea in the morning. What can she do about it? She's had it for many years. Does that sound like a problem to you?
It does, yes. Well, Mary, the first thing I would do is first investigate why you're having the diarrhea for so many years. Because the diarrhea could be from multiple reasons. You could be having an infection in the colon, or you could be having inflammatory bowel disease or irritable bowel syndrome, which is a functional problem of the colon. Sometimes it could be just the dietary habits. Sometimes you could have lactose intolerance. So first I would recommend you to have a colonoscopy, make sure your colon is normal, make sure there's no inherent issues in the colon itself, and then we will try to fix what you can do in the diet to adjust. Maybe you can take some fiber supplements to bulk up the stool, and then take it from there.
Mm-hmm. Okay, and we thank you for your call, Mary. Again, the telephone number is on your screen. Go ahead and give us a call. We have about 10 minutes remaining in the program. All right, we talked about hemorrhoids. You talked a little bit about anal fissures. What causes those?
The anal fissures are mostly caused by constipation.
Okay.
The other reason for people to develop anal fissure is the spasticity in the muscles of the anal canal. The anal canal is a muscular organ. Mm-hmm. There are muscles there to hold the bowel movements, and sometimes those muscles act too much, and that leads to the cuts from not being healed. So when we treat anal fissures, first we try to resolve the constipation issues by drinking a lot of water, giving fiber supplements, laxatives, and then we also help to relax those muscles. We use either ointments to relax the muscles, or sometimes even injecting botulinum toxin, the Botox, into the anal muscles to help to relax that. And that period of relaxation is enough to get those fissures to heal.
And sometimes surgical matters are required. Okay.
Yes.
And then let's talk about, as another call is coming in, the fistulas. What causes those?
So as I said earlier, it's the abscesses that usually cause the fistulas. There could be other reasons for people to get fistulas, or Crohn's disease, infections like tuberculosis, and sometimes even cancers.
Huh.
But most often it's abscesses, pus pockets around the anal canal that burst open and form a fistula. Unfortunately, most fistulas need surgical therapy.
Oh.
Sometimes they go away on their own, but that's minority.
Okay. We're going to talk to, well, we have another call who, the caller wants to stay off the air. I think it's Cecilia. And what does it mean when one has blood in their stool? I'm so glad you asked that, Cecilia. It was one of my next questions.
Cecilia, having blood in the stool could mean a lot of things. It basically means there is some blood in the intestines. It depends on what color the blood is. If you're passing bright red blood, most probably it's coming from the hemorrhoids or rectum or the colon. If you're passing dark, tarry stool, it's probably coming from the stomach or upper intestine. We go by the symptoms. If the symptoms are just bleeding and on examination there's nothing to explain it in the anal area, definitely we should have a colonoscopy first to make sure it's not coming from somewhere else, like a polyp or colon cancer.
Okay. And just like the last time you were on the program, we had a lot of calls,
Yes,
several of them,
yeah.
and another one is coming in from Sharon. Her father has constipation and a heart problem. He takes a diuretic, and should he drink a lot of water?
It's a good question. Sharon, the water we recommend is at least 6 to 4 ounces, which means 6 glasses of water. Now, I understand that your father has a heart problem and he's on a diuretic, which means he's on a water restriction. So he does not have to take 6 to 4 ounces, but enough to keep him well hydrated, which means he should have normal bowel movements. If he is having hard bowel movements, he should increase the water intake little by little to make sure he achieves those soft bowel movements. But in people with heart problems, kidney issues, they should go and consult the cardiologist or the nephrologist and follow the recommendations as far as the fluid intake is concerned. For such patients, the alternatives may be fiber supplements or stool softeners or laxatives to help with having easy bowel movements.
Okay. 5 minutes left in the program. Let's talk about some prevention and overall colorectal health.
Okay, good. Colorectal cancer prevention is in our hands. The government has set up goals saying that 80% of eligible patients should undergo colonoscopy screening in this year of 2018. That's the goal. But in Indiana and in the Midwest area, only 60% of people who need a colonoscopy are getting a colonoscopy. So it's very important for people to get this done and make sure they don't have colorectal cancer. Having said that, there are other ways we can screen for colon cancer.
Okay.
Nowadays, there are tests where you test the stool for blood or even DNA that is shed from the polyps. And that can act like a preliminary test for people who cannot just get a colonoscopy. For some patients, it's difficult to do bowel prep and undergo the procedure. Those kind of patients can get these tests done as a first stage. And then if there is something abnormal, they can pursue it with a colonoscopy.
Okay.
That's one option as well.
All right. Well, and I don't want to mention the brand name because we don't do that on public television, but I saw a commercial today for like a mail order stool test, if you will. Are those effective?
I would recommend these tests need to be done with medical supervision because the interpretation of the results can be complex. If people get the mail order tests done, they can get confused with the results. They probably may not need it to begin with. If they have had a colonoscopy, then you don't need to repeat those tests because if that comes abnormal, then you're left in limbo what to do next. I think these tests need to be ordered with the help of medical supervision, and the test results need to be interpreted with caution to be followed up with appropriate testing.
I had a feeling that's how you'd answer that.
Yeah.
It makes sense to me. I don't know if I want to put something in a box and say, okay, they're going to see if I'm sick or not. So I don't know. But anyway, we have another call here. Mary is asking, she has chronic constipation but doesn't take anything yet. How should she start a natural means to help her constipation?
The best way to help the constipation naturally would be first, water intake. 2, increase the amount of fiber in the diet. Fiber comes from vegetables, fresh fruit, salads, and then follow normal bowel habits, which means when you get an urge to go to the bowel movements, people should not hold it off. They should follow regular bowel habits. And then physical exercise. The right amount of physical activity and also the right amount of posture during the bowel movements also helps in prevention of constipation.
Okay, very good. And let's see. I wanted to tackle another issue here. I'm not sure if I have enough time. We've got a couple more minutes in the program. Let me go ahead and ask you that anyway. We've got 2 minutes, it says. So are there any occupations that cause, any occupational hazards that can cause some of these colorectal issues?
Good question. Yes, there are certain occupations who are at higher risk for colorectal issues, like truck drivers, people who stand for too long, people who lift heavy weights too long, because all this training and sitting and standing just increases the amount of effort they put on their hemorrhoidal area, and they have a higher chance of getting hemorrhoids. Sometimes people like truck drivers and people who sit for too long They're also at higher risk for anorectal abscesses and also fistulas from that.
Yes, in fact, one of my family members is a truck driver, and he had an abscess. Yeah.
Yes.
All right. Let's see here. We're going to wrap up very shortly, but we do want to remind our viewers that March is Colorectal Cancer Awareness Month, and if you haven't had a colonoscopy and you are due for one, please look into that, okay? And then also just check for those symptoms, you know, just in everyday life. If you have symptoms that maybe would be waving those red flags, see your colorectal physician or surgeon. And I think we're pretty much putting a cap on that for Colorectal Cancer Awareness Month. And
Yes.
Dr. Reddy, thank you very much for being here tonight.
Thank you.
Okay, and we will have you back again. And we really appreciate the fact that you were so candid and straightforward.
Thank you.
Okay, and then we're going to be back next week. We have Dr. J. Rex Parent with us, and we'll be talking about vision care, cataracts, refractive surgery, that whole gambit of things. And you'll make sure you want to watch that, and we'll have more questions and answers for you live here on PBS 39. Until then, we truly appreciate the fact that you're watching and you participated in our conversation tonight, and we'll be back next week, as I mentioned. And until then, good night and good health.
The preceding program on PBS 39 was made possible in part by
Beautiful baby, you're sweeter than strawberry pie. Just like the morning, your smile brings the sunshine.
The Parkview Family Birthing Centers, with everything you need for baby, plus birth planners, expert physicians, midwives, and more for you.
I'm a Parkview mom. You can be too.
Learn more at parkviewmom.com.